The fight against lung disease in the 20th century, the use of science and technology in diagnosis and treatment, the role of government. Lung cancer used to be rare, but it has been more common since the 1900s, and it is the second most common cancer today. Every year, 40,000 people are diagnosed with lung cancer. Medicine has proved that cigarette smoking is the major cause of lung cancer. Smoking was very popular during the early 1900s, and rates of smoking increased during World War I and II. Pleasingly, smoking rates in the developed world are down. 90% of cases of lung cancer are caused by smoking or passive smoking. Lung cancer is a difficult disease to diagnose, and this means it is only when the cancer has spread that the symptoms develop. Only 1 in 3 people live as long as a year after being diagnosed. Only 10% live more than 5 years after being diagnosed. Other cancer types have much better survival rates, where 50% live for at least 10 years after diagnosis. The fight against lung cancer has many different elements, and medical professionals are working to improve prevention and diagnosis and treatment. Governments have launched campaigns to prevent people dying from lung cancer. Government advertising campaigns warn people of the dangers of smoking. Cigarette advertising has also been banned, and more recently, laws have been passed which means cigarettes have to be sold in plain packaging with large health warnings. Recently, laws have been passed to hide cigarettes in shops and make it more difficult to purchase them. Laws have also been passed to make smoking in public places illegal. Through the NHS, the government has also invested in improving in treatments which are also dependent upon developments in science and technology. However, at present there is no national screening programme for lung cancer because the technology does not exist to pick up the signs of lung cancer developing in the body. There have been a number of treatments for lung cancer during the 20th century. The key treatments are listed below. Surgery has been used since the 1930s, but many lung cancer patients have other health problems which have meant surgery to be more dangerous. New surgical techniques like microsurgery have meant that the patient can be operated with much less stress on the body. Radiotherapy can target individual parts of the body to treat cancers locally. Chemotherapy. If surgery and radiotherapy are unsuccessful, chemotherapy can be used. This involves chemical medicines to attack cancer cells. Immunotherapy. Lung cancer can resist the body's immune system, so trials have been taking place to boost the immune system to stop the cancer cells from resisting it. The battle against cancer shows how different factors we have studied during this course are now working together to improve medicine. For example, government, science and technology.